Good evening and welcome to First Aid Chats by Dr. G. I am Dr. Adana Grandison, a physician in Barbados, and your hostess for this evening. First Aid Chats by Dr. G is a live podcast that provides listeners with a unique opportunity to not only hear a complicated medical condition explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. This evening, our episode is entitled Coming Straight from the Heart, and our guest is Dr. Andre Lovell. Dr. Lovell completed his MBBS in 2011 and then subsequently completed training in internal medicine in 2018. Currently, he is a consultant in the Department of Internal Medicine at the Queen Elizabeth Hospital, and over the past 6 months, he has played a pivotal role in the COVID-19 response, being one of the medical consultants at the isolation facility directing management and patient care. Outside of medicine, he has a keen interest in fitness and is a certified CrossFit Level 1 instructor. Within the medical field, however, his passion and interests are within infectious diseases and intensive care. Good evening, Dr. Lovell, and welcome. But before we get the ball rolling this evening, let's listen to Colonel Florence Gittins from the Barbados Defense Force as she shares from her series of hurricane preparedness tips.
Hi, I'm Florence Gittins, and I'm giving you a few emergency preparedness tips as the hurricane season approaches. Now, wet wipes are great because with a gallon of water per person per day, a minimum, you can have a bath. And it's hot after a hurricane and humid, and you feel miserable. Wet wipes are wonderful. Keep some.
Hello, good evening.
Hi, hello, Dana. Can you hear me?
Can you hear me now?
Yes, I can hear you now.
Okay, great. I'm sorry about that.
That's okay.
Technical glitch, clearly. Well,
Mhm.
welcome. Good evening, Dr. Lovell. Um,
Good evening. Thank you for having me.
Thank you. So let's get the ball rolling. Our title of this evening's session is called Coming Straight from the Heart. And we're talking about hypertension. Can you start off by first really explaining what is hypertension, or as we call it here in Barbados, high blood pressure?
Yeah. Well, before we get into exactly what hypertension or high blood pressure is, I guess we should really understand what blood pressure is generally.
Great.
And it is what it sounds like, is the pressure at which the blood is passing through your blood vessels. Now, what happens is every time your heart beats, the aim of that is to get blood from your heart to the rest of your body. And your heart has to do this with a certain amount of force to ensure that the blood gets around your body. Now, the ways that the blood gets around are by arteries, blood vessels, and these arteries are quite important when it comes to delivering blood and oxygen to different organs. And this is really where the blood pressure plays a part, because these arteries, they are elastic, they're able to expand and essentially accommodate the amount of force that your heart pushes the blood around your body. Now, hypertension occurs when the pressure of the blood going through the arteries is higher than what it should be. And this is important because this elevated pressure can cause damage to the blood vessels. And over time, when the blood vessels have been damaged, they aren't as elastic. They aren't able to bounce out and spring out to accommodate the force at which the heart is pumping. Now, when this happens, as you can imagine, there are arteries going to every organ. So when the blood vessels become damaged, and dysfunctional, the organs that they supply also get into problems. And every organ in our body requires a blood supply, and every organ in our body is subjected to blood pressure. So if we have an abnormality in that, meaning that the blood pressure is too high, we're subjecting every single organ in our body to that elevated blood pressure. And over time, this can cause damage. So the most notable places would be one, of course, your heart, because as the blood vessels aren't working very well, the heart then has to push harder to overcome the resistance that these faulty blood vessels have created. And as you can imagine, just like how you would be doing push-ups at home, if you do push-ups every day, your muscles get bigger. The same thing happens in the heart. If the heart has to push harder to get past the resistance of the dysfunctional blood vessels, the heart muscle can become larger as well, and eventually it can fail. So when you're doing push-ups at home, you can't do it forever. Eventually, your muscles get too tired to keep that up. So the same thing can happen with the heart, and this is known as heart failure. The same thing can occur in the kidneys, where after a prolonged period of time being exposed to elevated blood pressure, your kidneys can fail. It increases the risk of stroke. So it is something that it is quite important. The issue that comes along with it is that for most people, they feel quite well until, something serious happens, and that's why they call it the silent killer. And I probably want to overstate too much before Dana is able to ask me some more direct questions. But essentially, what I want you to take away is that blood pressure is the pressure at which the blood is going through the blood vessels. When this becomes too high, it puts you at risk of many, many complications that can affect any organ of your body. All right.
Sounds good.
Mm-hmm.
Okay, so you explained to us exactly what blood pressure is and what high blood pressure, or rather what an elevated blood pressure is in
Mm-hmm.
terms of the effect it can have on these organs. Now,
Mm-hmm.
exactly what do we consider to be high blood pressure? We always hear about systolic and diastolic, but can you break that
Mm-hmm.
right down for us and actually explain what it means from the standpoint of the heart?
Yeah. So when you hear blood pressure reading, you're going to hear two numbers. So you hear one on something. So you hear 120 on 80. So the number at the top is the systolic blood pressure, and the number at the bottom is the diastolic blood pressure. Now, what does this mean? Now, systole is when the heart contracts, the point at which the heart squeezes blood out of it and pushes it around the body. And that is what your systolic blood pressure represents. It represents the pressure of blood within your arteries at that point when your heart is squeezing blood around. The bottom number, which is invariably lower than the top number, is your diastolic blood pressure. Now, what is diastole? That is a period where your heart relaxes. So after it squeezes and pumps blood around the body, it now then relaxes. And this is the time period that the heart is able to fill with blood. Now, there's still a bit pressure being exerted in your arteries at this time. And it's not going to be as high as your systolic when the heart is squeezing, but it's still there. And that is your diastolic blood pressure. So the top number is your systolic. That's when the heart is contracting or squeezing. And the bottom number is the diastolic, which is when the heart is relaxing. Now, a normal blood pressure is less than 120 on 80. Above that is when you start to get into different categories. So one is your elevated blood pressure, and that is from blood pressure of 120 to 129 as the top number, the systolic, on less than 80. Now, from the time you get to 130 millimeters of mercury as your systolic to 139, that is what we call stage 1 hypertension, or the first signs of hypertension. So above that is when we start to wonder if you're hypertensive. Stage 2 will be above 140 millimeters of mercury on 90. That would be stage 2. Now, this is not just necessarily a one-off thing. This is done on at least 2 office visits. And I say office for a reason, because these blood pressures are what we're expecting when you actually go to your doctor and get it tested, which is where quite often these decisions or the diagnosis of hypertension is frequently made. The distinction is made because there are some settings that a person may not be hypertensive and have these readings.
Right.
And that is a case where some people, when they go to the doctor or go to a healthcare environment, their blood pressure goes up. Okay, so when the doctor or the nurse does their blood pressure, they get a higher than normal reading. And this is usually linked to anxiety or worry, or about the whole process of getting your blood pressure checked. Is it high? Is it low? And sometimes the person isn't even aware that they have this effect on themselves, but it occurs. This is known as white coat hypertension. In a setting where the person has blood pressures that represent hypertension, but only when they're in the office. When they're at home or otherwise, their blood pressures are normal. Now, I say that because the only way you're going to know your blood pressures outside the office or outside the healthcare setting is if you do your blood pressure outside the healthcare setting. And I think this is something that's very important to understand, because something like hypertension, a chronic disease, I often tell patients, the doctor is more like the supervisor. You're the one that has to put in the work. So it is very important that a person who has a diagnosis or may be getting a diagnosis of hypertension to check their blood pressures at home, to kind of exclude the chance of it being something like white coat hypertension. All right. So if you're able to get your own blood pressure machine, and you can go through this with your doctor to make sure that you're taking your blood pressure in the correct way, you should do that at home and document it somewhere in a book or in a notepad somewhere, so you can see what your blood pressures are usually like at home. When you then present that information to your doctor, it makes the doctor able to make a better decision when it comes to, one, if you're really hypertensive, and then two, if you require treatment, or three, if what your response to treatment is. So it is very much a place where, or a disease where the patient needs to be actively engaged in the management, even from the onset. So to make the diagnosis is always better even if you start to get elevated regions when you go to see your doctor, it's always best if you're able to do your blood pressures at home and see what your home blood pressure readings are. Because as you can imagine, the problems that come with hypertension is when your blood vessels are exposed to these elevated pressures for a prolonged period of time. Most people don't live at the doctor. They spend most of their time at home and etc. So getting the information, the knowledge of what your blood pressures are at home gives you a better idea of what your blood vessels are usually exposed to, and it allows you to get a better treatment regimen and a better understanding of what's happening with your blood pressure.
Great. Now, Dr. Lovell, you just spoke about white coat hypertension, but are there some persons who also have mask hypertension? In terms of, can you explain that term? Go ahead.
Yeah, it's kind of the inverse of white coat, where they may have good readings when you see them in the office, but then at home their readings are elevated, which once again reiterates the importance for being involved in your management and your own care, and the reasons for doing home blood pressure monitoring, because that gives us a better idea of what your readings are like. So mask hypertension is essentially the inverse of white coat hypertension.
Great. Now, you spoke about systole and diastole. And the systolic phase is actually when the heart contracts to pump that blood out of the heart through the vessels to supply the rest of the body. Whereas within diastole, when the heart is actually relaxing and filling, is actually when the heart supplies itself. So the heart is almost selfless in terms of giving to the body first and then taking for itself afterwards. And is there any importance in understanding in terms of your blood pressures because a lot of persons think that hypertension is only an elevated systolic blood pressure in terms of the number. But what about when you have an elevated diastolic number or the bottom number? Tell me about that.
Okay. Well, I, that in itself can be a discussion that can go on for an hour alone, because because you have some people who may have both elevated systolic and diastolic pressures, and that is the one that you encounter more often. Now, why that is significant, as you can imagine, diastole is a point of where your heart relaxes. It's part where your blood pressure is at its lowest, where the blood vessels are being exposed to the lowest blood pressure that they are facing, and furthermore to that, the period of time it take that your heart is relaxing is actually longer than the time that it is contracting. So the majority of the time, what your body is exposed to is more so related to your diastolic blood pressure relative to your systolic blood pressure. So people who have markedly elevated diastolic blood pressures, the problem is that their blood pressure, their blood vessels, and their organs and stuff never get a chance to have a period of time where they aren't
Relax.
faced with elevated pressures. Yeah, they're never relaxed. If you think about it, it's like a high strung person, always on edge. That is what your blood vessels are going to be like when you have something like diastolic hypertension, and like I said, the majority of time it happens in conjunction with systolic hypertension. But don't be fooled by saying, "Oh, well, my systolic is good most of the time, and this time your diastolics are well above 100." It the highest number that your blood vessels may be exposed to may not be as high, but the amount of time that your blood vessels are exposed to elevated pressures is going to be prolonged when it comes to diastolic hypertension. And like you alluded to as well, Dr. Grandison, that period of relaxation of the heart is when the heart actually gets blood supply for itself. So first it pumps it to the rest of the body, and when it's relaxed, that is when it's able to be supplied with blood. Now, if just like the blood vessels everywhere else in the body, elevated pressures damage the blood vessels that supply the heart. So if your diastolic blood pressures are elevated, you're damaging the blood vessels to supply the heart, then you can be decreasing your blood flow to your heart during that period of time as well. All right, made even worse by the fact that if you are chronically exposed to high blood pressures, like I alluded to before, making it comparing it to doing push-ups and your muscles getting bigger, you have more heart muscle to supply, but because of the damage and the pressure during diastole, you can't supply it as well. So you have a problem with supplying, but you have a lot more heart muscle to that requires blood from you. So diastolic hypertension definitely puts patients at risk of things like cardiovascular disease, heart failure, and these kind of things, because essentially there's no point where your blood vessels get that relaxation phase.
Absolutely. So we spoke about systole, diastole, hypertension. Who are the persons who are usually predisposed to such? Why would someone think, maybe I might have hypertension, or I should look out to see if I have hypertension?
Well, it is more prevalent the older you get. Okay, so above the age of 40, you should always be screening at least once a year, get your blood pressure checked. The actual guidelines actually suggest that any adult should get their blood pressure checked at least once a year. Now, but of course, there are some populations that are a greater risk of getting hypertension. Now, in Barbados, the prevalence of hypertension is so high, and I'm pretty sure everyone has a friend or a relative who has high blood pressure. It is very common here because we fit very much the demographic for people who are at risk of getting high blood pressure. People who are of Afro-Caribbean descent, Black people essentially, have a much higher incidence of having high blood pressure. In addition to if you have a family history, in which the majority of Barbadians have a family history, is associated with type 2 diabetes. Once again, over the age of 45, almost half of our population is diabetic. It's also associated with things with like obesity, having a Western diet. So all this being put together, it's very hard to find a person nowadays who does not fall into the category of someone who should at least get their blood pressure checked once a year to ensure that they do not have high blood pressure. If you have one of these comorbidities like diabetes, if you have kidney disease, your risk is even higher. So how often you get it checked should be more regular, every 3 to 6 months.
I see we have a question here. I'm going to pause in my questions. I see we have a question here from Tonia. Dr. Lovell, is it necessary to take a blood pressure standing, and why?
Okay, well, partly so. Sometimes it is. Now, generally speaking, the process of measuring your blood pressure, especially when it comes to the diagnosis and the monitoring of your blood pressure, is usually done in a seated position. Done sitting upright, relaxed, with your feet firmly planted on the floor, and you put the cuff at the level of your heart. Now, there's something known as orthostatic hypertension, meaning, or hypotension, I should say, meaning that some people have dramatic changes in their blood pressure when they go from a lying to sitting or sitting to standing position. Now, usually, what happens is that when you go from either lying or sitting to standing, because of gravity, lots of your blood starts to pool in your legs. Okay. But what your body does is that it contracts those blood vessels to prevent that from causing your blood pressure to fall. Now, in some persons, this doesn't happen. So, like for instance, people whose nerves aren't working well, like people who have had long-term diabetes, or if you are dehydrated, or maybe if your blood pressure medication may be a bit too high for you. So sometimes people do the blood pressure in a standing position so that they can compare it to when the patient is sitting and see if they have something like what I described, the fall in their blood pressure, which is known as orthostatic hypotension.
Okay. You spoke about Afro-Caribbean persons being more at risk. And we often hear in medicine a term being tossed around of a person being salt sensitive. And persons often hear about do not use any salt or cut down on the amount of salt you're eating. And can you explain to everyone the importance or the rationale behind a person who's salt sensitive and why it's important to actually reduce salt intake?
Yeah, so I think this is always a good thing to speak about when it comes to patients, because decreased salt, or what we would say sodium, which is a component of salt, that plays important in terms of your regulation of your blood pressure. Okay, so different organs help regulate your blood pressure, the kidneys being one, but the kidneys also allow for the elimination of sodium from your body. Now, some people, genetically predisposed or otherwise, are a bit more sensitive to this sodium, meaning that when you have more sodium in your body, or your intake of sodium is higher, your blood pressures tend to be higher. And this is because it causes you to retain more water, have more blood volume within your blood vessels. Now, decreasing your salt intake is one of the lifestyle modifications that has been shown to help with reduction of your blood pressure. And I take this opportunity to say that, in life, a lot of things are not created equally, but all salts are created equally. I say that it doesn't matter if it's table salt, it doesn't matter if it's sea salt, it doesn't matter if it's pink, if it's from the Himalayas. The reason it's salty, or kosher or not, the reason it's salty is because of sodium. So if it is salty, it is salt. It does not matter what else you put it with or what label you give it. It is salt. Now, studies have shown that reducing your salt intake could bring down your blood pressure by up to 10 millimeters of mercury. And Dr. Grandison can tell you a fall of 10 millimeters of mercury from a lifestyle change alone is quite a dramatic thing.
Significant.
All right,
Absolutely.
quite a significant fall. So, everyone, I often hear patients saying, is there something natural I can take because they don't want to take medications? I want a natural option. This is your prime natural option. Decrease your salt intake, and you will likely have a decrease in your blood pressure. If it was so easy, everyone would do it. The problem is that the westernized diet is riddled with having a lot of high sodium foods and is often hidden. Okay, so aside from just not adding salt to your food, you have to remember a lot of your commercial seasonings having salt, the Maggi cubes, I hope you aren't sponsored by any of these people, Dr. Grandison. Sorry for calling them.
No.
But all these particular things have added salt to them. Tin foods, once again, are usually very high in sodium, and although they may not taste salty, they definitely are things that you should avoid. Another thing that we tell patients is, prepare your own foods. Makes it a lot easier for you to regulate exactly what goes into your food. All right.
What about bread? I want to interject right there before we go any further. What about bread?
So yes,
Breads have a lot of salt?
Some of them do, very much so. I usually like to say, go after the big gun things, but if that makes up a very large portion of your diet, that is something that you can exclude to help decrease your sodium intake. It's sometimes very difficult to be regimented. If you go and do deep enough research, it will tell you exactly how many milligrams and so on you should be getting per day, or try not to go over a day. But that is very difficult for most people to go by. So making small changes quite often in terms of, avoid the salt meat in your rice. Don't put that in. Try not to use tin foods as much. If you're going to use seasonings, try to use ones that have no added salt to it, or prepare your own seasoning. These small changes can have a positive effect when it comes to the monitoring and treating of your blood pressure.
Okay. I saw we had a call coming in from Tony G. Tony G, do you want to try to call back in again? Hello, good evening, and you're live.
Hello, good evening.
Hi, good evening.
Hi, doctor. How are you?
I'm okay.
Yeah, so you have been diagnosed with some measure of high blood pressure, and you are on blood pressure medication. How do you get off of blood pressure medication, if that is possible? For most times, doctors tell you that you're on it for life. How do you get off? And if you are going to get off of the medication, what does that process look like? If you're to
Okay. Okay, that's a very good question. Thank you. The when you make the diagnosis of hypertension, not everyone needs to start on medications. It's usually dependent on the patient's risk, as well as on what their blood pressure is like. Some people do need to start blood pressure medications right away, but it's quite often that you hear patients wanting to come off of blood pressure medications. Before I go further, I want to make sure that it's clear that medications are not, hypertension is a chronic illness. So don't think that even if your blood pressures are better, that you're no longer hypertensive. That kind of almost, makes you get back into a point of maybe unnecessary comfort. You need to think, okay, I am hypertensive. I either have my blood pressures under control, or I don't have them under control. They may be under control with medications, or they may be under control with just lifestyle modifications. So even if you start with blood pressure medications, it is possible for the dose of those things to be reduced over time as your blood pressure control improves. And in some patients, they can actually come off of the medications if their blood pressure readings improve. But this usually happens because of the implementation of lifestyle changes. So, like I said, the basis of all management, whether you're on medications or not for high blood pressure, is lifestyle modifications. So things that have been shown to help would be one, like we spoke about before, decreasing your sodium intake. All right, so that has a very profound effect on bringing down your blood pressures. So if you start blood pressure medication and you decrease your sodium intake, you may get an added effect from that and are able to come off some of the medications in the future. Other things would be like weight loss. So they say for every kilogram of body fat you lose, you can bring down your reading by 1 to 2 millimeters of mercury. So people who are obese, losing some body fat allows you to bring down your readings and decreases the need for you to be on blood pressure medication. Things like smoking does it as well. So the main answer to that is yes, you can come off with the implementation of some lifestyle changes. That being said, there's another side of the coin. Although some people get some benefits from these lifestyle modifications, it may not get you to the point that you are not putting yourself at increased risk. So you're on medications now, and we encourage everyone to implement these lifestyle changes. But you may not get down to a point where you can be off of medications solely from these lifestyle changes. We must remember that the hypertension, 95% of people who have hypertension have what we call primary or essential hypertension, meaning that there's no one particular reason that you can pinpoint why they have high blood pressure. There's some things that put them at risk, but it's usually a combination of many things like your age, your comorbidities, your genetics, and things like that. And because of that, some people's hypertension or blood pressures may be so high that those lifestyle modifications, though they have some effect, aren't effective enough by themselves to allow them to safely come off of medications. So yes,
So,
it is
doctor,
possible to come off. Hi, yeah, go ahead.
yeah. So you have made the lifestyle modifications, and
Mm-hmm.
your blood pressure has come down. Do you take yourself off, or
No,
do or there is a process through which the doctor takes you off?
yes. So this is something that you do in conjunction with your doctor for sure. All right. This is definitely a relationship that's forged between you and your doctor to see what your home blood pressure readings are like, and we're able to tailor and adjust your medications to suit. The reason why I say you should not just decide to take yourself off if you see the readings is because one, some blood pressure medications have added benefits to your heart, etc. Then two, when you take off those medications, initially your blood pressures may seem fine the day or 2 days after, but later down the line, your blood pressures can start to creep up without you knowing. And you're then exposed to all of these complications of hypertension simply because at one point your blood pressures improved. Okay. But you should always have that relationship forged with your doctor where you can be going back and forth in terms of finding the ideal regimen for you when it comes to your medications.
Okay, great.
Okay,
I
thank
see we
you.
have another
You're
question
welcome.
here. Thank you so much. The question is it possible for your body to lack salt and you still have high blood pressure?
Yes. So one, your body is able to regulate salt quite well, and actually having a low sodium may be a side effect of some of the medications. But like I said, 95% of people who have high blood pressure, it is from a almost like a perfect storm, a constellation of different factors that puts you at risk that come together to cause you to have high blood pressure. So even in some patients where for the most part, your sodium level may be normal, but your blood pressures can still be elevated
Okay.
for sure. Hmm.
I see we have another question here coming from Yvette. How about if the patient that is slim, exercises, and has low salt diet that still has high blood pressure and is also on medication? And I think
Right.
you actually
So
you
this is
alluded to that. Yes, go ahead.
Yeah, so this person is doing what they should do, in terms of their diet, their lifestyle, etc. But their blood pressures are still high. What how I like to explain to the patients, because sometimes they come and they say, "But doc, I'm doing everything I should. How is it that my blood pressure is so high?" Or I say, "No, yes, it is high, but if you weren't doing these things, it may be even higher." So these lifestyle modifications that this person is doing probably has their blood pressure lower than it would have been if they were not doing these things, but it's not necessarily yet to target. And this is when things like medications come on board to get you down to a level where your body isn't at risk. A lot of this is a combination of risk factors. So some people, even if they do everything they're supposed to, in inverted commas, may still develop high blood pressure. But our job, I say our as in both the doctor and the patient, is to ensure that we are able to get the blood pressure down to a safe level and to decrease your risk of developing cardiovascular complications in the future.
Okay, great. I see we have another question here from Tonya. Uh, if your blood pressure continues to be elevated over time, could it cause damage to other organs, such as your kidneys, for example? I am going to pause on that question because I want to throw one question in just before that, before we go to end organ damage, because I think that that's a very interesting area for us to delve into. But I
Mhm.
wanted to ask Dr. Lovell, a lot of persons are on hypertensive medication, and they may notice
Mhm.
that throughout the day they may have differences or changes in their blood pressure. Sometimes they have very good blood pressure control, and then at another time, even though they're on the hypertensive medication, their blood pressures can become elevated. Now, on that
Mhm.
backdrop, we often hear about persons being at most risk around 3 o'clock in the morning for the potential of having a stroke. And then there's the concept of dippers. Can you talk a little bit about
Mhm.
dippers, which is a phenomenon that we know about in hypertension? We were talking about hypertension.
Yeah. So the phenomenon of dipping actually speaks to your blood pressure being lowest when you're having restful sleep. Okay, which for most people is at night. So physiologically, your blood pressure tends to fall during the night. Now, the reason for this is that this is a time where your body is resting and recuperating, and a lot of the hormones, the stress-driven hormones like cortisol, adrenaline, those kind of things, are at its lowest. So it allows the same way your body, your mind is relaxed, your blood vessels become relaxed as well, and your heart doesn't have to beat as hard to get the blood around your body. So quite often people can find about a 10 to 15% fall in their blood pressure when they're in deep sleep. And this is normal. Okay. When the process of you going from the other way, going from sleeping to waking, is when the reverse of this happens, and the hormones are then released, and um, the levels of those go up, and your blood pressure starts to rise again. Now, why is the concept of dippers or non-dippers significant? Is that way that people check people's blood pressure is to do something called an ambulatory blood pressure monitoring, meaning that you have a blood pressure monitor on for a 24-hour period. So we're able to see your blood pressure quite frequently over the course of that entire 24-hour period. And it was found that this same phenomenon that we're speaking about, that at night people's blood pressure fell, but it didn't happen in everyone. There are some people who are what we call non-dippers, meaning that their blood pressure did not reach that low level during sleep. Now, this suggests that they don't have the regression of these hormones as what happened in the normal physiology. All right, and these people are at greater risk of cardiovascular disease. These people, because as the same way we spoke about diastolic, these people's your organs, etc., are going to be more at risk or more exposed to your elevated blood pressures. Now, this happens. it's important to have the caveat of having restful sleep, because as you can imagine, if you're sleeping and you're awoken every 30 minutes, you're never really going to get to that relaxed deep phase. Now, this doesn't happen to most people, but there is a population of patients out there who have something called obstructive sleep apnea, where is usually associated with obesity, and they wake many times during the night. Now, they don't realize that they wake, but everyone around them realizes that they wake many times in the night. It's almost like, sometimes you're sleeping, somebody wakes you up, asks you a question, you go back to sleep, and you never remember that it happened. So these people could wake many, many times at night. And there's a relationship because of that between sleep apnea and having hypertension. So probably not to, I try not to stray from the point too much, but essentially you expect that in the time of your deepest sleep that your blood pressure will be at its lowest. And the people who this phenomenon does not happen in, it tends to put them at a greater risk.
Hmm. So we have, okay, so I have another call coming in from Tony G. Hello, good evening, Tony G.
Hi, good evening.
Tony G, you're live. Okay, I'm not hearing him at this time.
Oh, I think
it just glitched. Okay, let's see it again.
you should probably try again.
Yes.
Hi, Tony G, you're live.
Yes.
Go ahead.
Yeah. Could you explain, doctor, the relationship between high blood pressure and diabetes? How does diabetes play into blood pressure, and what is the relationship between the two of those?
Yeah. Okay, sure. Now, diabetes and hypertension, many people have both of them. And the reason why they're important to note together is because the complications are very similar. Both of them put you at cardiovascular risk. So they both increase your risk of getting heart attacks, increase your risk of getting strokes, increase your risk of getting kidney disease. And one potentiates the other, meaning that if you have hypertension and you have diabetes on top of that, the complications can accelerate faster, and the same goes the other way. Now, the reason for that happens once again at the level of the blood vessels, because diabetes damages the blood vessels. Okay, so this is why some people with diabetes get what you call poor circulation and get the wounds on their feet that don't heal very well, is because they get the damage to these blood vessels. And we understand from how hypertension works that we need these blood vessels to be healthy to be able to accommodate the pressure of the blood being pushed out by the heart. So if you have diabetes, which is causing your blood vessels to not work very well, if you put hypertension on that, you now have faulty blood vessels damaged by diabetes that now have to try to withstand elevated blood pressures. So you're putting more work on less functional blood vessels. If you think about it like a plumbing system, so the heart is like the pump, and the blood vessels are like the pipes that supply the pipes that supply the town or whichever with water. Diabetes damages these pipes. So diabetes causes them to rust and erode and that kind of thing. When you now have these damaged pipes and the pump is going, these pipes cannot tolerate the pressure that the pump is pushing out. And you get things like burst mains, etc., which in this case can be heart attacks and strokes and that kind of thing. So the reason why the relationship is that because at the level of the blood vessels, they both affect that, and the complications are similar. So they both affect them in the same organ. So it's like a double trouble kind of scenario.
Mm-hmm. Good. Mm-hmm. Dr. Lovell, we want to head in now to what we call an organ damage in medicine. But the organs are actually affected by hypertension. And we often hear about the heart and the brain, but I'm actually going to take it from the other side and actually deal with some of the other organs that we don't quite often hear about. Can you tell me briefly in terms of what can happen at the level of, let's say, the eyes?
Yeah. So no one could find an organ that does not need blood vessels. Okay, so at the level of the eyes, the same thing can happen. There are blood vessels that supply the back of the eye, and what happens is that if these blood vessels are exposed to elevated pressures, they become damaged like everything else. And the same way, like I spoke previously about the rusty pipes, how they could erode and you can have a burst vein. You can have the same thing in the back of the eye. So you can have things like hemorrhages, you can have edema of the nerve in the eye. So the same concept applies everywhere. So hypertension, yes, it does cause strokes and so on, but it affects your eyes, it affects every single organ in your body because every organ is reliant upon a blood supply. Okay, so any organ that's supplied by blood is affected by your blood pressure.
Right. And kidneys, because a lot of persons are very, very concerned about kidney disease. And quite often we even hear sometimes patients saying, I don't want to start hypertensive medication, sometimes even diabetic medication, because the medication is actually going to damage my kidneys. Can you tell us, one, about the damage that high blood pressures have on the kidneys, and then how some of these medications actually protect the kidneys?
Okay, yeah. I'll try not to get too much into the nitty gritty, but
Sure.
what the kidneys do, they act like as a filtration system. Okay, so they filter out impurities from the blood, and you can think of it almost like a strainer. So what you put in is the blood, and what comes out is the waste product. So it retains all the stuff you need and excretes the stuff that you don't need. Now, hypertension at the level of the kidneys, the blood vessels become very involved in the filtration system. Okay, so they're very sensitive to elevated blood pressures, and the kidneys actually play a role in the regulation of your blood pressure. However, if you bombard the kidneys repeatedly with elevated blood pressures and it causes damage to this filtration system, it kind of dampens your abilities for your kidneys to do that, to regulate this blood pressure. Now, over time, when these blood vessels are damaged, is like if you damage that strainer. So remember, the strainer is the kidneys, the blood is what you put in. The thing that stays in the strainers is everything that your body needs. What comes out the other side, the urine, is the waste product. If you damage your strainer, you poke holes in it, things are going to get out that are not supposed to. And the same thing happens with the kidneys. So its ability to differentiate between what needs to get out and what needs to stay in is lost. And this is essentially kidney failure. Now, what the medications do, and there's a certain types out there that, aside from just lowering your blood pressure, they're what we call nephroprotective, because they go to at the microscopic level of the kidney and are able to affect certain parts to protect that strainer mechanism. Okay, so the level, so it gives you benefit outside of just the blood pressure control. So yes, your numbers may come down, but what your kidney is exposed to is even less, and it helps protect that strainer system so that your kidneys maintain the ability to keep what is good inside of your body and filter out what you do not need. All right, I'm not sure if that was clear.
Absolutely, absolutely. You guys can
Yeah.
also tell me. We have another question here, and then we're going to deal with some more end organs because we only have about 9 more minutes. So let's take this question quickly. Hello, good evening.
Hello,
You're
good
live.
evening. Yes,
Hi.
good evening. Good
Good
evening,
evening.
doctor. Dr. G mentioned about hypertension being the silent killer. But there's a bad headache where it gives you a blood shot in your eyes in the end. Could that be a symptom? And how does exercise help control that hypertension?
Thank you. That's a good
Right.
question.
Yes. So the hypertension is known as a silent killer because most of the time you don't have any symptoms. You're walking around, and the only time you realize that your blood pressure is elevated is if you actually get it checked. Now, often you hear people say, "Oh, I'm okay, I'm fine." It's just when my my blood pressure. I know when my blood pressure is high because I have a headache. that's actually very risky. Okay, because if your blood pressure is high to a level that is causing symptoms, it means that you're kind of on that cusp of having a complication of your hypertension. Okay, so the like what the caller spoke about, the burst vessel in your eye, that's what you can see. But imagine what's going on the inside. Imagine what's going on in your brain, because the reason, if your blood pressure is high enough that it's causing symptoms, you're at a critical phase. Okay, you need to go see your doctor and let them know what's going on, because it needs to be controlled. The point of causing symptoms means that your organs are not only being damaged, but they're starting to lose their ability to function.
And
Okay,
to cope.
it's just, and to cope. It's just like a person. Sometimes you may not feel well. You may be a little tired. You may be under pressure, for a lack of a better term, but you're still able to get up and go to work and do your daily functions. If that pressure in your life becomes too much, that you can't get up and do your normal activities, then is a problem. The same thing applies here. If your blood pressure gets to a point that your body says, you know what, I can't keep this silent anymore, I need to let them know something is wrong. You need to act on that. And you need to take it very seriously, because it is you. If you get symptoms like the headaches and so on, you are lucky enough to not be a person that it has silently attacked. Okay? Because quite often it's too late. The warning sign is something like a stroke, a bleed in the brain, a heart attack, or something like that. If you're getting to the point of having symptoms, this is your opportunity
To make it
take
right.
to make it right. Take the advice that your body is giving you, because your body is letting you know this blood pressure is about to cause you some big problems. Okay, you need to act upon that.
Great. Dr. Lovell, I know that one of the concerns a lot of men, and I speak specifically to the men because I know generally men don't often come to the doctor, but when they do, sometimes they have the concern of taking their hypertensive medication because they may be concerned about their sexual function. And so they would say, Doc, I really don't want to go on any medication because then I'm not going to be able to function as I used to. Is that true?
Okay, well, how I like to I can't say not. There are some medications that have the side effect of that. And this is where you kind of work in tandem with your doctor, because you can always change regimens. But more importantly to that, like I said before, there's no organ in your body that's not supplied by blood. Okay? And the male reproductive system is no different to that. Matter of fact, having uncontrolled hypertension is a significant risk factor for impotence, because you're very reliant on having a healthy blood vessels to perform such activities. So if your blood vessels are being damaged by hypertension, they're going to get to a point where they can't perform their activities. So if you are concerned, if you that it may have an effect on your sexual prowess, you should think even more fundamentally and understand that high blood pressure has a similar effect. Okay, not only on the blood vessels there, but the blood vessels in your heart. Overall, your ability to do any physical activity, especially sexual activity, will be limited. So you say A, you say B. Yes, there are some medications that have that side effect, but those medications can be changed. The
Good.
damage from hypertension is there. So what you want to do is avoid the damage from hypertension. You can always change the medications if that arises. If you allow the damage to be there, damage is there.
Okay. I want to slip this way. You spoke about also stroke, which is also quite important, and
Mm-hmm.
also heart attack, which is a major problem that we can have with elevated blood pressures. I'm not going to go into heart failure because our very first podcast actually discussed the journey to heart failure. But here we
Mm-hmm.
have an interesting comment, and I think that is something that we should probably lend a bit of clarity to. It says, to be clear, some websites state that stage 1 hypertension is 130 to 139 and stage 2 is 140. However, WHO states that normal blood pressure is 1/3 on 120, and blood pressure is considered to be raised or high at 140 or above. So just wanted to clarify for listeners. Thanks.
Oh, this is a very controversial. I probably shouldn't say controversial, but yes, I could understand why it would lead to some confusion. And the reason why you often can see sometimes from time to time, from year to year, the the market kind of moving from where you call someone, diagnose them of having hypertension versus not. So what this listener speaks to is probably the more common American Association definitions for what hypertension is. And the reason why these changes were made, i.e., having your marker a little lower, meaning that okay, you get to 130, you have hypertension, while normal is less than 120. It gives you an area there between 120 and 130, which is just known as elevated blood pressures. Now, the reason for doing that is because they say prevention is better than cure. This is what they found. Going towards lower blood pressures, making this diagnosis, making it apparent to the patient at a lower blood pressure, kind of highlights to them a need for intervention and a need for change earlier. Okay, and exposes them to the risk factors for complications a lot less. So when you have the point where you are not actually hypertensive, you just have the elevated blood pressures, which would be from your 120 to 129, they advocate getting lifestyle changes. In other words, you're starting to get around the trouble area. This is the point where you can act to prevent yourself from having issues in the future. So it's a more preventative way of looking at it by having these cutoff values a little lower. Now, at the 130 to 139 area, from the physician's standpoint, what you do in this time is really dependent on your patient's risk. So those patients who are a higher risk of cardiovascular disease, so those who will have like diabetes, um, kidney disease, or something else that puts them at risk, you have to be a bit more aggressive during that stage versus someone whose risk is very low, where you can continue to say, let's get your lifestyle changes under control and go from there. Above 140, the risk is pretty much clear for everyone. So the reason for the person is right. Before, the 140 was a lot more to cut off, but now they've gone a little lower in terms of the 130. And the reason for that is that they have found through research and different studies that people who have been exposed to this 130 to 139 over a prolonged period of time still have higher incidence of complications compared to people whose blood pressures are lower. So although their risk is not as high as someone whose blood pressure is terribly out of control, there's still increased risk there. And targeting them and making interventions earlier has better outcomes in the long term. So it's a more preventative way of going through your management and definitions of hypertension.
Okay, and just like that, we are out of time, Dr. Lovell. We didn't even have enough time to finish this segment with you. It was very robust, and we could probably go on for another hour about this because
I
there's so
know.
much to know about hypertension. But I really
Well,
want
my
to
mother always told me that I talk too much, so maybe she was right.
And I just want to say thank you so much. And again, thank you to our listeners who have participated in the call-in session or on the message board. Once again, I encourage you to follow us on both Podbean and Anchor and join us next week on First Say Chats by Dr. G, Closing the Gap. Next week, we have Dr. Joanne Michelle Martin, and we'll be discussing sexual dysfunction and the pelvic floor. Have a good evening, everyone. Thank you, Dr. Lovell.
Thanks. Thank you.